The MTC is a center of innovation, and we have probably about 15 of them in the US, about 40 around the world. And in each MTC, we do a number of things. I think of it as people, place, and process. In terms of places, as I mentioned, we have in each MTC a number of experiences. Some of these experiences are focused on healthcare, some of them are focused on retail, some of them automotive, manufacturing, financial services. Each MTC tends to have something of a specialty. In Chicago, my MTC, we have three focus areas. One of them is the healthcare experience, and you can see some of that behind you. The second one is retail, and we're just in the midst of launching a brand new intelligent retail experience. And hopefully next time we get together, if we are fully up and running with the retail experience, I'd love to give you a walkthrough of that as well. And the third, which we are still in the planning stages of, is an intelligent manufacturing experience, which goes through optimization of the manufacturing process. So I sometimes liken it to an adult version of the Epcot Center, or like a geeky version of the Epcot Center, where people can come in and they can put on a HoloLens and they can play around with what not just the future looks like, but what the present looks like as well, or what it could look like for many organizations. So that is the place aspect of it. Then there's a people aspect of it. And within each MTC, we have a variety of technical architects who cover different aspects of the Microsoft platform. I cover business applications. I'm also the chief technical architect, who is the leader of the technology part of the MTC. I'm also the healthcare experience lead for all MTCs. So that means I am the subject matter expert for everything as it relates to healthcare across the MTCs worldwide. But I have people who are a PhD in AI. I have someone who is a specialist in Azure, someone who's a specialist in Microsoft 365, someone who is a specialist in data. So I have people who cover everything, and we together do a variety of things for customers. We can help with everything from hackathons to proofs of concept to creating reference architectures to doing design thinking workshops and everything in between. So that's what the MTC is in a nutshell, and that's what I do at the MTC. So let's talk a little bit about healthcare today. I really like the fact that we did this roundtable in the beginning where you're each giving your point of view on things that seems I'm getting some feedback here on this. I'm going to spotlight myself here for a second. So in the event that not everybody can see me. Okay, I assume everybody can see me now. Okay, perfect. Yeah, so getting back to what I was saying here, at the intelligent healthcare experience here at the Microsoft Chicago MTC, one of the things that was important to me was building an overall experience that can highlight what it is that we can do specifically in healthcare. So what you're going to see over the course of the next hour is going to be a focus on many of the innovations that we're doing in healthcare. So I was really excited by what we were talking about in the beginning when you were each giving your perspective on the future of healthcare, some of the things that you would love to see, because so many of them overlap with the areas of investment that we've made at Microsoft. Someone talked about wellness, right? And being proactive and trying to maintain wellness as opposed to help people recover from illness. That is a big focus area for us. And I think historically, everything has been very much encounter focused. This idea of you get sick, you go to the doctor, you get medication, and then you leave, and you don't come back until you get sick again. And in many respects, that's a very backwards way of looking at things, because it's much easier to maintain someone's health when you prevent them from getting sick than when you wait for them to get sick and then you treat them. But in order to do that, it really requires historically a much more or a much closer relationship between a physician and a patient in ways that are often counterintuitive or that are impossible to scale. You can't have a physician there telling you, oh, you shouldn't eat this because it's too much sugar and you're at higher risk of diabetes. You're sort of on your own, or you're sort of on your own when it comes to that, because it's just not the way the relationship traditionally has worked. But what if you could have a pocket physician, right? What if you can have an AI-powered physician that can give you alerts, tips, tricks, reminders of ways that you can really optimize your health? That's really where the future of healthcare is going. And this is something that we at Microsoft are at the forefront of doing. So what I'm going to show you over the course of the next hour is going to be the intelligent healthcare experience and some of the things that we're doing to help with that. All of this fits into something we refer to as the quadruple aim. I don't know if any of you have heard of the quadruple aim and what the quadruple aim is, but it's these four target areas of healthcare now. And the first part of the quadruple aim is how do you help optimize the individual patient experience, right? So how do you create the best possible experience for a patient? The second is, how do you positively impact the population as a whole? So how can we serve an entire population of people and help manage their health? The third is, how do we lower cost overall and then deliver care efficiently? And the fourth, and I'll tell you, originally it was the triple aim. And then one of the things that we started realizing with data was that there was a key part of this missing. And this was, what is the clinical experience like? One of the things that you might not be aware of is physicians have one of the highest suicide rates in the world. And the reason why is because in many respects, they are overworked, they are understaffed, and a lot of what they went to medical school for, which was to care for patients, has now been subverted to an extent by doing a lot of administrative work, right? Where I'm spending all of my time inside of my electronic medical record. I'm spending all of my time on paperwork or on billing. And now I'm spending so much time doing this, I can't spend enough time doing patient-facing work. And when you are in an emergency room, right, or you're in the operating room, or you're on call, that can be very burdensome. And so it's led to a significant spike in physician burnout and a significant spike in physician suicides as well. So when we realized that, we were like, this isn't really the triple aim, it's the quadruple aim. Because the fourth one is, how do we optimize the clinician experience? How do we make it so that the clinicians are able to do what they do best, which is to care for patients? So all four of those are really what healthcare organizations have spent a lot of time trying to achieve. And it's a difficult thing, but we're trying to do our part to achieve that. So if you join me for a second here, I'm going to make a transition over, and I'm going to show you a little bit more about what the healthcare experience looks like. Okay, so here I am now inside of the intelligent healthcare experience. So what is that exactly? It is, in the Chicago MTC and a few other MTCs, a replica healthcare space. This replica healthcare space is something that goes into a number of areas through the continuum of care. There's a home health area that's here. Oh, let me make sure I am spotlighted. Oh, yes, I am spotlighted. Very good. There is a home care area. Oh, Andrea, you can't see me anymore? Or are you okay now? Okay, I'm going to, should have myself spotlighted. Let's make sure. Anyone else having trouble? Here, I'm going to stop spotlighting
It shows
here.
you as spotlighted, Charles.
Okay, so let's spotlight myself here. Okay, can you see me? Waving? Still no?
Yeah. Yes.
You can see me.
Charles, I see you. This is Pat.
Okay. Good. But it seems like some people can't see me.
If anyone can't see Charles, please come off mute and let us know.
Yeah, Andrea said she can't. Who else? Hannah said she can't either.
I can see you just fine.
Okay. I'm not sure why it
Yes,
is.
Brian,
some
I
people-
can see just fine as
Okay.
well.
Okay. It's weird that not everyone can. I'm going to turn off the camera and turn it back on just to make sure. Let's exit the spotlight here. Okay, and now I am back on. And I am going to spotlight myself. Okay, is this better? Okay, Andrea, how are you doing? So, okay. Yeah, try and refresh. I think Adam's right. If you're looking at it through a browser, try and refresh the browser. Because it seems like everyone else is okay except Andrea and Hannah. Okay. So I think before I give you the walkthrough of the tour, I'll finish explaining what exactly all of this stuff is. So there is oh, you're back. Okay. Can you see me okay?
I can see you now. Thank you.
All right, great. And Hannah, can you see me okay? I'll wait for her to give me the thumbs up on this. I'll start going in the meantime, and I'll see if she gives me the yes or no. I don't think I see Hannah on right now anyway. Okay, so continuing here, within the healthcare experience itself, there is the living room area, and the living room area is the home health area. So we have a lot of innovations with home health. We have the physician's office, which is a primary care physician's area. We have the, oh, welcome back, Hannah. Okay, can you see me waving? Yes, okay, so I think we are good to go. We have the physician's area over here, and we have a number of innovations I'm going to show you in the physician's office that will help optimize the physician-patient experience. Behind me, I have the hospital area, and we have a operating room / recovery room over here. We have a hospital front office over here. We have a back office over here. We have a radiology lab over on the opposite side of that. And then we have a call center as well. And so those are the various areas that we have here. So I'm going to give you a walkthrough tour. Virtual tours are never quite as cool as the real thing. So hopefully once we reopen to in-person tours, you're all cordially invited to come and visit. This way you can try some of these things out for yourself. But let's go ahead and get started. So the first thing to point out in the home area is the presence of a lot of different home technology. A couple of things in particular I wanted to draw your attention to was this. This is something called a PRIA. The PRIA is something that's now owned by Black & Decker. But one of the things that we talked about that you initially mentioned was this idea of, how is it that you can bring the wellness experience home? And one of the ways that we do that is with this sort of robot. Think of it as an Alexa version of a doctor, where you have this robot here that can do things like remind you when you have to take your medication. And then it can dispense pills at the time you have to take your medication. So for people who don't always remember to take their medication, which is a common source of complications for people who have different types of chronic illnesses, you can have the PRIA here give you those kinds of reminders. Now, the PRIA is built on the Microsoft platform, And therefore, the PRIA can do things like read your medical chart, and based upon your medical chart, can give you different types of wellness tips. So if your blood pressure is a little bit higher, if your A1C is elevated, if you missed a dosage on your medication, the PRIA can give you reminders and different types of tips. In the event that you continuously forget your medication, the PRIA can get in touch with your doctor directly and let the doctor know that there may be a problem that's brewing. And it's not always because you don't care about your health, but in many respects, it's because for a lot of people who are lower income, you have to choose between paying for your refill prescription or having dinner, right? And this is a very, very common problem. So in the event that you see factors like that, we refer to that as social determinants of health. If anyone lives in places in large cities like Chicago, it becomes very easy if you start looking at some of the charts to see that there are significant differences in life expectancy on a per zip code basis within the same city. It can sometimes be a life expectancy difference of 3, 4, 5, 6 years. And in many respects, it's because of these social determinants of health. So anything that we have that can help to address some of those disparities is something that's worth a significant investment for us. And this is an example of one of them. So she can come in and chime in anytime with different types of questions, or you can ask her questions. So if you wanted to, if you had some sort of symptom, you can ask the PRIA or about symptoms that you would have as well. So if you wanted to evaluate a fever that you might have, you can talk to the robot about this. And then the robot at the end will say, based upon this, we think you should make an appointment with your physician. I can make an appointment for you. And then she becomes the interface between yourself and the physician for making an appointment. Even better, the PRIA has a camera embedded in this. So for people who are either unable, or for people who are unable to come into the physician personally, and sometimes it's because you might not have a car, you know, in many neighborhoods, you're not close to a primary care physician. And if you don't have a vehicle and you're working all day, every day to keep food on the table, it might be 3 buses and a train to get to the nearest primary care physician. And for many people, that's a significant barrier that prevents them from getting the care they need, or from even doing things on a preventative basis to get your annual wellness check, your annual physical. You just can't afford to take off time to do it when it's a 2-hour trip by bus and train. So increasingly, virtual care has become important. It's really taken off as a result of what we've seen with the pandemic. But even before that, there's been a spotlight on that as a potential solution to people who are in remote areas where they can't necessarily have ready access to that kind of care. So virtual care has become a very important piece of trying to address some of these social inequities. So having something like the PRIA so that you can have your annual wellness check remotely at home on a weekend is something that's a significant investment for many of my customers and my partners as well. Now, you might look at this and say, yes, but how can it take your temperature? How can it take your blood pressure readings? And actually, we have many of these home devices. So if we look here as an example, this is an example of a pulse ox. This is a remote pulse ox that can interface with the PRIA. So if I wanted to take a blood pressure reading, or I wanted to take if I wanted to take a blood oxygen reading, I can take this reading here. It's going to be captured by the PRIA, and then the primary care physician is going to receive that in real time, along with various types of assessments. How did that compare to the reading during the last appointment? How did that compare to the reading last week? Are you making progress, or are you at risk of anything? Pat, you had a question?
Yes, thanks, Charles. And pardon me if you made this clear. Pardon me. Is the PRIA provided through health insurance, Medicare, other support?
Yeah, I think they are looking to have this provided through Medicare. In order to do that, it has to be registered as a medical device. In order to be registered as a medical device, you have to register it as meaningful use to the FDA. They're currently in a process of applying for that. And then once they get FDA clearance, which could sometimes take a number of years, then it will be considered a medical device and can be covered by insurance. For now, it's primarily something that would be paid for perhaps through the employer or perhaps directly by the patient as well.
Got it. Thanks.
Yep. Great. Okay. So that's an example of one of the home care areas. Another thing that we have, you might notice back here, and I'm going to push this a little bit closer so you can see a little bit more clearly. Is something we refer to as, colloquially, as the doc in a box. This is something by a partner of ours called Global Med. And what this is a suitcase doctor. So you have a wide variety of medical devices that are in here, and then it's attached to a Microsoft Surface as attached here. And then for people who do home care, if you have various types of home care nurses, for example, which is very useful for people with various types of physical limitations, or for people who, once again, are in rural areas and therefore not close or convenient to physicians. We are now increasingly seeing these home care nurses, home care physicians who will go on site to somebody's home. So what we've started seeing now are things like this, where you might have a home care nurse who goes to somebody's house and he or she will bring this with them. And when they do, using the Microsoft Surface with Microsoft Teams installed on it, you can connect remotely to the primary care physician or to a specialist. And by combining this with what I have on my head right here, which is a HoloLens, I can now turn this on, and when I do, the primary care physician or the specialist can see through my eyes. And not only can that physician see through my eyes when I have this on, they can also see all the various vitals here as well. So when I turn this on, if I do things like take their blood pressure, or if I started looking through their ears or their nose, or I took their temperature, all of these readings are going to show up in my HoloLens glasses, and in turn, it's going to show up on screen for the specialist or for the physician, even if they are many, many miles away. So this becomes a powerful way of connecting people who might otherwise be very difficult to connect physically in person. So part of that entire virtual care scenario is something where you can have these worldwide connections between different types of specialists. And by having a person as a stand-in, it'll be like you're there, right there with them. Okay, and that's a significant area of investment for us as well. Pat, was this the second question you had, or did you just happen to leave your hand up?
Oh, sorry. I'll lower it.
No problem. No problem. Okay, so that is an example of the doc in a box. Additionally, when it comes to patient engagement, what we refer to as patient engagement is a means of having something to answer patient questions. We talked a little bit about the PRIA being one means of doing it, but you don't necessarily have to be quite so fancy. You have a number of options as well. So in the event that you didn't have this sort of robot, you could use your phone, right? So this is an example of a tablet. So just a basic iPad, or it could very easily be your phone. And within this, we can have an app here. And this is an app where I can have communications with a bot. So I'll give you an example of what that looks like by sharing it directly. So let us share the screen. Okay, so this is an example of what this looks like. So you might have some sort of app that perhaps a hospital would release or a physician would release. And within this application, this is where you'd be able to do things like request appointments. You'd be able to see your medical records. You'd be able to get your care plan here as well. When we talk about care plan, what that means often is what happens after you finished your encounter? What happens after you've met with your physician? What happens after you've been discharged from the hospital? In many respects, you would get some sort of wellness plan or care plan that will give you instructions on what to do to stay well. One of the biggest problems and one of the biggest causes of people being readmitted to the hospital within 30 days is the fact that there's no real electronic care plan. You'll write something up, right? Or you'll maybe take notes while the doctor talks at you at 1,000,000 miles an hour, but you're still a little bit groggy from the anesthesia that you have. And they say, okay, you have to go to Walgreens or CVS and here fill your prescription, and you have to call me next week. And then you have to make sure you walk X number of steps, and you have to make sure that you keep your weight down to this level, and you have to do this and you have to do that. And as a patient, you're thinking, oh my goodness, like how do I maintain all of this? And maybe you'll get an email about it, right? Or maybe someone will write it down for you on a piece of paper, and where'd the piece of paper go? But imagine instead, everyone has their phone nowadays. Most people have their phone nowadays. But if you do, imagine having a place where all of your different care plan activities show up right here, right? So what are the things that you're supposed to be doing? So you can go and refer to this at any time. Imagine having push notifications on your phone that will tell you when it's time to take your medication, when it's time to refill your prescription, when it's time to go for a walk. Or increasingly now, people have different types of smartwatches. So imagine having your watch be programmed with your care plan. So I have this watch right here that actually gives me reminders on certain things to do to maintain wellness. Now, Adam brought up a really good point when he says not everyone has a smartphone, right? Not everyone has that internet connectivity. So we've also seen similar things being sent via text for non-smartphones. So many of these, older generation phones being used and using text messages as a point of communication for that as well. Or even having automated phone calls that'll come up with different types of reminders too. So we have many different channels for doing outreach and communication with patients so that even if they don't quite have all of these fancy pieces of equipment, they're still able to have a means of staying in touch with their care team as a whole. So this is an example of what that looks like. So if we look at, go back home for a second here, and let's say I have a virtual assistant and I had some questions about my care plan, or I had some questions about an appointment, I can get started here. Now, using something like this, start a new one here, I can either use my hands and I can type in a request, or I can have a guided request, or if you notice on the bottom right-hand side, I can use my voice. So even if I do have certain physical limitations, I can still communicate with this, whether it's through typing, whether it's through voice prompts, or whether it's through other types of prompts that you would have. We have different types. We have something called the Tobii Eye Tracker. The Tobii Eye Tracker can be something where you can use your gaze, and your gaze would then determine what it is you're selecting. So you can, essentially type on it, or you can select from a number of options just using your eyes. So let's do an appointment request. And then it'll say, how would you like to search? And I might say by specialty. And it'll say, what kind of specialist are you looking to see? And I can either voice prompt and say primary care, or for me, I'm just going to say primary care physician. And what would you like to schedule? And I might say as soon as possible. So here's where some of the AI comes into play. The AI is now going to look at the physician who all work at these, who might work at this hospital, who might work at this clinic area, And it will look at their schedules. It'll see when the next available date they have. It'll look at your profile, because if it happens to know that you are a working mother and you have to pick up your kids from school at 2:30 every day, it might have note of that in your overall profile as a patient. And then it'll look at the two and it'll say, okay, based upon this, the next available date is going to be 2:30 next Wednesday, okay, or 10 a.m. next Wednesday. So the AI is going to find the ideal time for it. So you're not looking through your calendar. You don't have someone who's looking through the calendar as well. The AI does all of that for you. So I'm going to say, let's do 10 a.m. next Wednesday. And now it says, great. So it's generated an appointment for you. It's going to send you information either via text message or via email, or maybe via push notification inside of this as well. So I might say, let's send a text message. Okay, and I'm now going to get a text reminder of the appointment. It might also send me an appointment via an Outlook or a Gmail invite for it, and this way it'll be on my calendar as well. For anything else that's necessary, I can go, and if I wanted to complete anything that's in here, if I wanted to update my medical record, if I wanted to update my insurance information, anything else that would typically or historically be done in the waiting room, I can do beforehand. So this way, I come to the hospital or to the clinic, and they immediately have everything that they need. So I don't have to spend as much time waiting. I can go directly to the appointment and immediately begin the appointment. Okay, so those are all examples of some of the home health scenarios that we have in here. We have many, many, many more, but for the sake of time, believe it or not, 1 hour is not enough time to walk through all the demos that we have here. But for the sake of time, I'll move on unless anyone has any questions about home health. I'll give you a few seconds. Okay. Oh, how is this different from my chart? That is a wonderful question. So my chart, for those of you who are unfamiliar with it, is a patient portal that is part of Epic. Epic is one of the major electronic medical records. And historically, Epic has always been very encounter focused. It's always been about the appointment itself. And my chart is a place where if you wanted to come in and maybe send a message back to the provider, or if you had different types of things like, here is your prescription, you'd be able to see this as well. My chart by its nature is dumb. So there aren't really very many AI type capabilities added to my chart. So we don't replace my chart. What we do is we enhance my chart. So one of the things that we do, and I'm going to point this way for a second here. Let us extend this a little bit here. So what we do is there is a chat that's in here. So this chat is a chat bot that can sit on top of my chart. So in many respects, you go to my chart and you send a message to your physician, a secure message, you wait for your physician to get back to you. And maybe you wait till the end of the day, maybe it's the next day. But imagine instead saying, I have a question about my bill. And now, rather than waiting for the physician or someone else to get back to you manually, you have an AI system instead that's able to start answering questions about your bill that you would have, or start answering questions about your appointment you have coming up, or if you wanted to know what sort of medication you should take. You actually have AI now in the position of answering some of these questions for you. So a lot of hospital systems will take these kinds of chatbots and put that on top of something like a My Chart to make My Chart better. Does that answer your question, Hannah? And let's see if there are any other questions that came through here. Okay. Yes, very good. Thank you, Hannah. Okay, so let's move on. So now let's spend a little bit of time talking about some of the things that we can do in the primary care physician's office. So within the primary care physician's office, which is over here, I'm going to spend some time going through some specific demos in this. Let's turn this off. Stop the broadcast. Okay. So now I should be back in full screen, and hopefully I am back in full screen.
You are?
Okay, excellent. So in the primary care physician's office, we have a number of other types of capabilities in here as well. And I think it'll be more exciting to share my screen when I get to it and show you some of the things that we're doing here with AI transcription. But this is where a lot of the interaction takes place between the physician and the patient. And we have capabilities that can really help address, in particular, that fourth of the quadruple aim. And that is improving the overall physician experience as well. If you've ever been to a physician, and sometimes you'll increasingly see them behind a screen and they're typing while you're talking, right? And maybe they'll occasionally glance up and look at you. And I think it's created a lack of personalization in many respects that can sometimes be a little bit problematic. So one of the things that we've started introducing now is something that can do a lot of the note-taking for you. So the physician no longer has to spend time typing and looking at their screen. All they need to do is treat you the way that they do best. And then you have AI behind the scenes taking all of the notes that you need. Not only that, but the physician can use it as a digital assistant by saying, okay, let us file a prescription for a medication for this patient here, or let's do a follow-up for next week. All the physician has to do is say it, and then the application AI behind the scenes is going to start initiating all of that behind the scenes. So the physician doesn't have to do anything but treat the patient. And I'll show you what that looks like in a little bit. Over here, this is where we have many of the hospital capabilities. So we have a number of AI-powered hospital capabilities that are in here. This is another application called Clinical Access Station. This is something that rounding nurses would often use. So it's a push cart that they would use while doing nurse rounds to go from patient to patient. And within a nurse round, this also has a surface embedded inside of it. Within the surface, you're able to run perhaps Microsoft Teams, where within Microsoft Teams, you would be able to communicate with the physician on call. While communicating with the physician on call, the physician through Teams can use this camera to evaluate the patient the same, very similar to as if they were there. We'd also be able to use these different types of vitals monitors that would provide real-time vitals that would be visible to the physician on call, even while they are remote. This is something that really became a powerful weapon in the fight against COVID when many people had to be isolated for an extended period of time. Having something like this that would allow people to remotely formulate treatment plans was something that was very, very critical for many of my healthcare customers. Here, you'd be able to see some information about each patient that you have next as part of your rounding. And rather than having to log in to the electronic medical record and have to click around and try and find a patient and what's your date of birth and what's your last four of your social security number, it's able to automatically identify the patient, pull the patient's chart up, and then I'd be able to see everything I need to see about the patient directly. And I'll show you a little bit more about what that looks like when I start sharing some of the screens in the applications. Well, this is an example of where you'd be able to see all of the relevant patient information being surfaced to the top. So rather than having to manually go in and click through things, it's going to present information to me contextually based upon what it's identified as the primary concerns of the patient. Okay. Additionally, over here, we'll be able to see some aspects of mixed reality. So this is an example of one of the newest, and let's move this over here just a little bit. One of the newest innovations among some partners of ours. So one of our partners is a company called MetaView, and MetaView uses mixed reality to enable surgeons and physicians to, through a HoloLens, start mapping out what their surgical path is going to be. So think of it as having X-ray vision. So X-ray vision is a great way of saying, okay, I'm going to take a CT scan and I'm going to take ultrasound, and I'm going to see it overlaid on top of a patient. So when I'm determining what my path is going to be for a surgical or for surgery, what this will allow me to do is now say, okay, I can avoid all of the blood vessels going in this way. I can avoid the spinal cord. I can avoid anything else that I need in here while navigating inwards and allowing me to basically see through the patient and avoid anything that I have to avoid when getting rid of a tumor, as an example. So, and if you were here, you'd be able to put on the HoloLens, you'd be able to see it for yourself. But just to give you an example of what that looks like, if you look at the screen here. So this is the view through the HoloLens itself. So as you can see, as you have the ultrasound going, you'd be able to have maybe through Microsoft Teams a remote session where you might have a specialist who is guiding the ultrasound tech to try and identify areas of concern. Using the HoloLens, you can interact with the holograms here, and I don't really have to take my eyes off of anything. I can have a guided experience directly in here that'll say, here's the path of how you can attach the needle and guide the needle directly to where the tumor is while still missing all of those critical blood vessels. Okay, so this really helps you to map the best possible path for that sort of treatment. Okay, so MetaView is a really great application for doing things like that. We can also use mixed reality for doing things like looking at a patient and while, let's stop this for a second here. Okay, because the audio is on. So another use of mixed reality is, we can look at a patient and I can remotely connect to somebody else through the HoloLens, and I can view their vitals through the HoloLens. And using something called remote assist, we can actually draw things out. So you can have a physician here that will draw something virtually on the patient, and then I can use this as a way of trying to zero in on certain areas. They use something called remote assist. It can also be used for doing things like setting up different types of equipment and different types of devices as well. Over on this side, and let's open this up here. We have some of the hospital back office capabilities. So these back office capabilities in here will give me some really good visibility into the operations of the hospital. So there are a couple things we have here. One of them is a virtual tumor board. And you can use this for things like people getting together virtually to chart a course of action for tumor patients. And this becomes a great way of having many worldwide experts getting together virtually and saying, here's a complex case that we've never really seen before. Here's what we need to know about it. Here are the diagnoses that we have. Here are the people in stage 1, stage 2, stage 3. Here is some of the core information about it. Let's put together an overall treatment plan by combining our collective knowledge and our collective expertise. You can use this as the basis for zooming in on specific cases as well. And you can use this to put together a course of action as part of a collective care plan for patients that you have who might be particularly challenging for you. You can also use this as part of something called IoMT, or Internet of Medical Things. These are connected medical devices, and this is an example of one from Stryker. And what you might see, and I'm going to bring this up a little bit so you can see this a little bit better. These are all connected medical devices that will give you information about things like estimated battery life, estimated useful life. It can give you predictive information about whether or not something's in need of service or is not quite working anymore. It can even let you know which ones are currently in use. So from a hospital planning standpoint, this is something that becomes very, very powerful because it allows you to figure out, okay, what other departments might have some loaners that are here that we can borrow. Okay, so it allows you to plan things out much more efficiently. And if you ever talk to someone who works at a hospital, that is a big, big time saver. Okay, moving on over here, let us look over at the radiology lab. The radiology lab is an area over here, and looks like it expired. Let's go in here. So this radiology lab is a place where we can have a lot of different AI-driven insights. So one of the things that we've seen now is something called InterEye. So Project InterEye is a Microsoft project that uses AI to look at different types of medical imagery, and it can identify cancerous lesions, it can identify tumors, it can identify a number of questionable things. And I know sometimes radiologists, when I do these tours, get a little bit nervous. Like, does this mean you don't need me anymore? And that's not the case. We still need the radiologist. So it's not doing the radiologist's job. But there's a little bit of dark humor that radiologists like to share amongst themselves. And it is a radiologist is just a little bit better at the beginning of the day than at the end of the day, right? Because they're humans. So we don't think of this as a replacement for a radiologist. We think of this as a second opinion, something to say, have you seen this? Have you checked this? We've identified this as well. What do you think? Doctor, do you concur? And this gives the radiologist a second set of eyes to make sure that they haven't missed anything. So it's not replacing them, but it's that safety net, right? It's that additional check that's there. And that's something that's become an important tool that helps to supplement the radiology process as well. Within Microsoft Teams, you can have the radiology lab continue to coordinate care with everyone else. So if we wanted to look at some patient data through Microsoft Teams, we'd be able to see things like orders coming through and orders pushed through Microsoft Teams. And I'll show you a little bit more about that when I start doing the screen sharing directly. But it becomes a great way of having a distributed team of people, whether they are in the hospital or across different hospitals, all get together and look at the same set of patient data, which is something that's a bit more collaborative in nature than what you get out of the box with something like an Epic or MyChart for that matter. Okay. So I'll pause here for a second and just check and see if there are any questions that came through. Okay, Andrea, the AI physician's assistant will definitely help physicians free up time. Yes, definitely. Are you in healthcare, Andrea?
I know a lot about healthcare. I've done some work in healthcare.
Okay, good. Yes, yes. Should also help them improve delivery quality of care measures. Yes, absolutely. Absolutely. Yeah, so when you talk about care measures, you know, the classic HEDIS score, right? So you have your HEDIS score and you're saying, okay, what impact have you had on the health of the population, of your population as a whole? Absolutely. Okay, very good. So at the hospital back office, these are examples of some of the analytics that we have. And this is all powered by Microsoft Power BI. So one of the unique things about Power BI relative to perhaps Tableau is the fact that not only is it useful for getting insights into stuff, but it's also actionable. So an example of what that looks like is, this is an example of a population dashboard. So we can look at all of the uninsured people in a given population in Illinois as an example, and maybe let's zoom in just a little bit. And within a given population here, I can now zoom in on perhaps Cook County, and now I can look at everyone within Cook County who is underinsured. This is real data, by the way. We have a lot of uninsured people in Cook County. I gotta let it sit here for a little too long. Let's reload it and try it again. Okay, so we are back. So I can click into this, and you notice, 852,000 uninsured people in Cook County, Illinois, real data. So by clicking into this, this will give me a list of people who, based upon medical information I have about them from the electronic medical record, are going to be at high risk of diabetes. So from a wellness standpoint, what I'm going to do is I'm going to add them to a diabetes prevention campaign. And when I do, I can click create. And now by clicking create here, this is going to automatically create an AI-driven campaign for everyone who is at elevated risk of diabetes. And that's going to include a variety of different tips it's going to send them various newsletters. It's going to send them different types of offers for things like significant discounts on fresh foods. Because in many cases, you think about the correlation between food deserts and diabetes, or food deserts and heart disease. Food desert, for those of you who are less familiar with that, is are neighborhoods that are not close to sources of fresh food. So you might have like a Popeyes there, you might have a 7-Eleven there, but there's no Whole Foods there, right? There's no Mariano's there. And that can sometimes,
Pardon
and that
me,
leads.
Charles.
Yes.
Charles, would you do me a favor and for anyone in the group with vision loss, kind of describe the monitor layout?
Yeah, absolutely. So what we're looking at is a map, and this is a map of populations of patients. And the map is a heat map in nature. So each of these red circles here will correspond to how many people match certain criteria. So if I wanted to look at the concentration of patients who don't have insurance, if I wanted to look at the concentration of patients who are at elevated risk of breast cancer or diabetes, I can launch different filters to identify these at-risk populations in a map. When I then click on that area of a map, it's going to bring me the list of patients who meet the criteria that I've set. So whether that criteria is what I have here, people who are uninsured and at elevated risk of diabetes, or whatever it may be, I will then receive a list of patients. I can then take this list of patients and I can then add them to a campaign simply by giving the campaign a name. So I call it high risk diabetes. And then I added them to a campaign that says diabetes prevention seminar. When I click create, it automatically takes that population of patients and then adds them to the campaign where we can have a lot of automation. And whether that automation is some sort of call down campaign, or whether the automation is going to be newsletters that get sent over to them with different offers, or even something that might allow me to determine different types of partnerships. If I look at certain areas on a heat map and I see that there are certain neighborhoods where there is an unusually high risk of heart disease, perhaps if I wanted to have a partnership with, for example, a farmer's market, or with a food delivery service, some sort of fresh food delivery service, that's going to be the area where I might want to deploy that farmer's market, that mobile farmer's market. And this is how I can do my part as a healthcare CEO to help impact the wellness and health of the population, which again is part of that quadruple aim that healthcare organizations are focused on. Okay, was that helpful?
Yes, thanks, Charles.
Yeah, not a problem. So what happens throughout this process is, as we do this, we have this orchestration that takes place here. So think of it as a flow chart, where based upon the criteria that was set, so I said there is a segment, people at high risk of diabetes, and then I'm going to send them an email with an invitation to a free diabetes prevention event. And then if they register, then we're going to send them instructions on how to log in. If they don't register, perhaps I'm just going to send them a newsletter, right, with some follow-up tips. And then on the day of the event, if they attend, then we're going to give them a thank you for coming. Here are some follow-ups. If they don't attend, we might say, sorry, we missed you. Here's a recording of what was here. So it can continue to evolve based upon how the patient has interacted with the campaign. This is also useful for helping patients with chronic conditions. So you can say, has the patient refilled their prescription? If yes, good, continue. If they haven't filled it yet, we're going to generate a phone call activity that would then have someone from the physician's office call them up and say, hey, we noticed that you've missed your prescription. Is there anything we can do to help, right? Why might that be? And this can be something that can serve as a reminder or a means of helping manage the wellness of, in particular, chronic care patients who are constantly on medication. Okay. The final thing here is going to be the call center. So the call center, this is an example of some of our call center technology. And this call center technology is tied into phone systems as an example. So whenever a patient calls in, you'd be able to, as soon as they call in, get all of their information in here. So it might be some information about when their last appointment was, when they have their next appointment scheduled, information where if they perhaps forgot, so when, or do you have directions to where my appointment is, as an example? You can easily get some of that information in here. Or they might have some questions about their bill, right? So if we, and one of the things that we can do from an AI standpoint is look at the conversation between the patient and the call center, and then start automatically providing resources to the call center agent to address the patient's concerns. So I'll give you an example. We look here, and if I were to say,
so Charles, again, would you be willing to kind of explain the layout of the monitor for anyone?
Sure.
Thanks.
So yeah, so this is an example of an application that is going to present information about the patient here. So as I mentioned a little earlier, the patient's history, previous phone calls that they've had with you, previous appointments that they've made. If they have a physician that they've worked with, you're going to see that on the page as well. And this is going to show up as soon as the phone call comes in for the call agent. So over on the left-hand side, we have something called conversation intelligence. So conversation intelligence is going to be something that can listen in on the phone call between the patient and the call center agent. And just to give you a demonstration of what this looks like, I can't afford to pay my bill. So what happens here is it listens to that and it classifies it as financial hardship. So because it's classified as financial hardship, you get a little score here and a little frowny face, and the frowny face says, oh, this sounds like a problem that the patient is having. So now it's going to automatically pop up a resource here that is going to show a website in the middle that's going to include information about financial assistance. So now that patient information is going to be replaced with information about some options for enrolling the patient in a financial assistance program. You can use this as the call center agent to either send the link directly to the patient who's calling in, or to describe information about how exactly to enroll the patient inside the financial assistance program. So here we have a website that will say financial assistance is available. It has a section under it that has eligibility requirements. It'll have a financial assistance policy, and it gives you options to download the financial assistance policy as well. So this can be something that helps the call center agent get the right resources to the patient almost without regard to the kind of question that they have. And that's all powered by AI. Any questions about this so far? Okay. So those are the core areas that we have as part of the intelligent health experience. And this is really a small percentage of everything that we have in here. But what I'm going to do now is transition over to my main screen, and I'm going to use the opportunity here. And how much time do I have left, by the way?
About 5 minutes, Charles.
Okay, no problem. So I'm going to transition out. Give me just a second here. And I'm going to exit the spotlight. And now I'm going to go back to my main area. Okay. Hi again, I'm back. Hopefully you can see me. So I'm going to share my, excellent. I'm going to share my screen and show you a couple of things in person. So the first thing here is we can look at some core patient data as part of an enhanced patient view. This enhanced patient view is going to include your core patient information. So it might include basic information like the patient's name, their primary practitioner, phone number, other information in here as well. All of this is stuff that comes directly from the electronic medical record. But we can enhance this with additional information. So if I wanted to look at information about, as an example, their blood oxygen levels. So we can see their blood oxygen history that's here. We can see their physical activity levels. And these are things that might come from a smartwatch that they would have. Increasingly, we're seeing smartwatches as medical devices. So you can see some of these covered by insurance now. So even for people who can't necessarily afford an Apple Watch, you can still get access to some of these devices here as well. I can take a look at some of these other devices that are attached to this, and I can look at things like their blood glucose levels over time, and we can see, and we can set different types of alert lines. So from a wellness standpoint, which was one of the points that somebody made very early on, helping with the preventative aspect of care as opposed to a reactive aspect of care. So let's not wait until their blood glucose level is high. Let's look and see when it starts trending upwards and try and attach and try and address it then. We can also look at a social determinant survey. So we can start getting an idea of some of these social determinants of health and figure out what types of programs we can add to them to help address any issues that they might have. So this is the survey that's going to ask questions about their education levels, about their employment levels, about their occupational exposure to risk factors. So have they had occupational exposure to radiation, to noise, to dust? And based upon this, it can help to suggest an overall care plan that's all AI driven. That's one example that we have. Another example that we have of something that's very much AI driven is having something that once again can listen in to the nature of the conversation between a doctor and a physician. So we look here and we can see over on the right-hand side the transcript of a conversation between a doctor and a patient. And I can generate a note from this by clicking on the note generation. And what it's doing is it's automatically taking the transcript, it's running it through AI, and it's organizing it into things like social history, family history, a history of present illness, past medical history. And this is going to enhance this with information that comes from their medical charts. It'll further enhance it with their medication history, some information about their vitals from a physical exam. And then it can take all of this and recommend an overall plan of care. So it's recommending preventative information, continue weighing yourself, return to the clinic in 1 week, check your thyroid. So the AI, once again, it does not necessarily replace the physician,
but it enhances the physician experience, because as a physician, the only thing I need to do is generate the note. I don't have to type things in anymore. It does all of that for me. Another example of what that looks like in here is through this view. So for each patient who comes in, I can look at the patient, and this can be something that's done through Microsoft Teams. So this is a view of Microsoft Teams where within the patient view, I can see all of the patient's vitals information. I can look at information about perhaps if they are in the hospital, what's their fall risk, what is their latest SpO2 or blood oxygen reading, what is their latest temperature reading, is there anything of interest? And here up above in red letters, it says they are a COVID-19 patient. We can see here their medication history, and then the AI is once again going to take all of this information, and on the far right, it's going to let me know about certain areas that might be of concern. So the fact that there is a possible negative interaction between two medications that they've been prescribed, or that there is a recent decrease in their blood oxygen level. Might that be an early warning sign of COVID? Or there might be a recent increase in their A1C level, so we recommend a dietary change. When I click some of these alert areas, we can add people to a campaign that might perhaps pair them with a fresh food program. So again, this idea of helping them out very early on with certain interventional things here. Finally, down below, rather than having to click through and do searches for things while looking through pages and pages of medical history, I can simply ask the AI system a question. So if I wanted to say, for example, what was the highest temperature, right? Natural language. And it'll tell me the highest temperature for this patient ever measured was 106 degrees. And I said, wow, that's interesting. Now I'm going to change that from what to when was the highest temperature. That was my Priya robot. I guess it's now time for my medication check-in. I don't know if you heard her, but it was interesting. But here it says, okay, that highest, no. So the highest temperature was taken, yes, thank you. So the last temperature was taken May 26th, and it was 107 degrees or 106 degrees back on May 26th. So again, this idea of having that interaction that's all AI driven. So a physician no longer has to click, 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 click. They can literally use voice commands, or they can literally just type in questions, and it's automatically going to take things and provide assessments and answers for me. Another way that this looks here, and then I'll wrap up and turn to any questions that you might have, would be we look at this interaction, and within this interaction, within Microsoft Teams for a virtual care, we can automatically get patient history based upon the nature of the conversation that's happening between the patient and the physician. So if I wanted to ask questions or I wanted to issue commands, I can very easily go through here and I can basically say, okay, let's set a follow-up appointment, right? Or let me ask a question about what their last temperature reading was. And I can do this again through Microsoft Teams simply by going into the chat and then typing in some answers while still looking at the patient up front. So what you're seeing here is I'm basically connecting to the application and I'm just typing in a message saying, get the chest x-ray for Marlon Hutchins. So when I type in and get the chest x-ray, it's going to go into the electronic medical record and it's going to pull up the chest x-ray automatically. So I don't have to click through anything. I don't have to look through anything. I can continue looking directly at the patient over video, but I'm still able to see everything that I need in here. Okay, so those are all examples of some of the AI-driven capabilities that we have for healthcare. So I believe I'm at time, so I will pause here and open the floor up to any questions that anybody has.
Charles, this is Pat. First of all, love that your Priya interrupted you for your medication. I didn't know it was your Priya, so now I do, and everyone does. But on a serious note, is the workshop or any elements of the workshop being road tested by hospitals, systems, etc.?
Yes, yes. This is not the hospital of the future. This is the hospital of the right now. If you write a check to Microsoft,
Yeah.
you can get all of this stuff. So yes, perhaps not everyone is using everything in here, but we have many hundreds of providers, of health insurance companies, of pharmaceutical companies, of medical device companies who are using at least some aspect of things that you saw today.
Great.
Great. Other questions? Okay, let's see if anything's here. Oh yes, social determinant of health. Yes, can you describe? Okay, vision. Yeah, hopefully I did a good job at the end of describing some of those things. The vision impaired. AI assessment recommendation will be extremely powerful. Yes, seeing multiple providers, especially translating those notes. Yes, for primary care physician, definitely. And then some of the integrated holistic care and specialized care, definitely. Oh, thank you, Andrea. Great. Okay, well, that was all I had. Well, that's not all I had. I have a lot more, but I think that's all you can take for now.
Charles, as much as I'm sure I'm not alone in your audience, we'd love to have you come back perhaps, or ideally when ITKAN can meet again at our host, the MTC, arrange for you to really walk us through real-time presentation, perhaps of some of the other elements of the workshop or modules. That's all I want to say is thanks so much. This was very engaging, intriguing. I'm sure that's unanimous. Brian, did you have anything?
Thank you very much, Charles. This was very interesting.
Great, thank you.
Okay, Charles, you're off the hook. And great job. Thanks so much. What a great presentation.
Great, glad
Thanks
to hear it.
everyone for joining us as well.
Great, thanks again. Looking forward to